Russell.
Thank you, Chair. If I may come to you first, Nina, if that's okay to call you Nina. Just on any form of racism and discrimination is appalling and should be removed at the first possible opportunity. But I just wondered, obviously you've talked a lot about nurses and doctors and staff. How far did this look at, and the research that's been happening, look at porters and cleaners and staff who work within the NHS and within social care and provide also an incredibly important job?
That's a really good question, and we did seek to cover this in our report. I don't have some of the key stats to hand, but would be happy to follow up. What we did find is that the NHS, the standard contract, sets out expectations about equal treatment for all staff, and obviously that stems from the Constitution in 2009 as well. We know that there are a significant proportion of black and minority ethnic groups working in sort of outsourced positions or under contracts that are outsourced, and I think that wider workforce is in the region of around 3 million. Need to double check that, but that's a real significant number of people who potentially might be being overlooked when it comes to some of these initiatives that trusts are trialling. And I guess this might be something that Shilpa could talk more about, but some initiatives like staff networks, they're definitely open to staff who work under Agenda for Change conditions, but what's less clear is, are forums like that also open to roles like porters or other outsourced types of workers? And I know this is something that trade unions are very keen on, of course. And I guess it boils back down to the point of looking after all staff who work in the health and care workforce, particularly as we come out of this pandemic and given everything that they've contributed and worked so tirelessly over. It's definitely an area that warrants more investigation.
Absolutely. And I was going to go to Shilpa, and I noticed, Dr. Wang, you've got your hand up. So if I go to Shilpa first, because you mentioned her, Nina, if that's okay. So Shilpa, your thoughts on that in terms of that, the expanded workforce, because they, the porters and cleaners and those teams provide such an important part of the NHS and social care. But I think sometimes whenever we're doing these sorts of reports, they can get sadly a bit overlooked, and I imagine that might be the case in this instance as well.
Sure, that's absolutely true, and it's definitely an oversight that so staff who can fill in sort of key data collection surveys, such as a staff survey, which contributes to the RES. Staff who are working in bank or agency, so those who are subcontracted, don't get to fill those in. So we do have quite an oversight about what their overall work experience is like. But lived experience data is so important, and there are ways to seek that absolutely from at a more local level from members of the wider workforce, as you say.
Thank you. And Dr. Wang, I noticed you had your hand up while I was asking the question.
Thank you. I agree with what Nina said, and also I would like to address your question is. We have this Equity Act since 2010. Why racism still prevail now? One of the issues come out and the solution addressed by NHS staff, they tell me is it's not accessible to report, and it's also very difficult to collect evidence to prove racism. Therefore, they propose, because we have this COVID track, we have this app. Can we use this app? It has been used in Bristol in some medical schools. It's proved very successful. Report and support, so they can report this incidence of discrimination through the app with anonymous or not non-anonymous. They can choose, so it can encourage this speak up culture, because many BAME workers was fear of their job security because they haven't gained their visa, or career progression. If they speak up, they might suffer. So we have started a good innovation during the COVID. Yes. I wonder we can use this one.
Very good.
May I ask just another couple of questions, if that's okay, Chair?
Yes, please do. And then we'll wrap up, but far away.
Thank you. Just on the point about the app, though, I mean, is that accessible to everyone? I mean, it sounds brilliant, and I think it's great that you can do that reporting, but I just worry that the invisible workforce are the people who are working the night shifts, working in the basements, doing the cleaning, all of those things that, as I say, are such an important part of the workforce. And often with racism and discrimination, it's often top down, isn't it? You know, it's sometimes it could be a power play, sometimes it could be many other things that come into it. But actually, if you're working in those sorts of jobs, it's probably a bit of a fear factor to report those things, even if you know it's anonymous. And I just wonder whether what work you've done to make sure that people who might use the app, A, know that it's safe to use it and it is anonymous, but also making sure that that part of the workforce is really embracing it.
It is really hard, but to your surprise, I recently did a project for union, and I interviewed many people. They're very good at using technology, even they are in their 50s. And I actually integrated job review data. You know, on Indeed and Glassdoor, people post their employment experience based on this and produce this written evidence. And you can see people tell about this toxic culture in their organization. They're actually good to pick it up, the technology, because the technology has started during COVID. We can push this momentum to keep going. But you're quite right, it's very difficult to collect evidence. Staff told me, there are 3 layers. There are inner circle and outer circle. We immigrants, outsiders, to choose shifts. And she told me, everyone can pick up to do the night shifts. But for 3 months, she was picked up. And she said all the name was put in a jar. It seems there's a certain way to fold the name. So such kind of evidence is very difficult to collect. So we have a senior manager hold accountable, and middle manager have training how to deal with. Then we have app. Hopefully this can help to address the issue.
And if I may just come to you, Prima, just on that general theme, is there an app for social care? I mean, what's the feedback from frontline workers within the care sector?
On the subject of racism, I honestly believe that it's not as widespread as in the NHS, because I think the initial problems are when somebody comes to join the team and they cannot communicate as well. And I think communication is always a problem. But once they have settled in and the staff get to like them, then the atmosphere in a care home or even in domiciliary care is very much one of we are the team. So if anything is put on like a party or whatever, everyone is included. And they really do care for each other. And if there are issues like sickness or mental health issues, they do support each other. But as I mentioned before, it's that first few months of getting them to settle in, because our existing staff don't have the patience and tolerance to bring them on. But once they are there, they're great. And I have to say that my experience of overseas workers, and we include the Europeans too, is that they have a better work ethic. They do take their responsibilities very seriously, and they are loyal and committed. And I have staff working for me for upwards of 8 years, from this particular community, and still loyal even after they've left to go to another organization. So just to go back to, it is that very first few months of nurturing and supporting and helping. But in every other way, they're actually quite equal, and they have got good career opportunities because we support them. And now I'm speaking not just as me and my organizations, but as the chair of the Suffolk Association for Independent Care Providers. And I see that right across the board.
Thank you.
In Suffolk.